very proud to say that we are working under his dynamic leadership.
The Sabapati Mudaliyar and Kuppuswamy Mudaliyar, they have donated this land for only for the hospital purpose. The Anbai Award Parimala Madam received is a very much satisfying and proud moment for all our Karnataka hospitals. The more number of institutes have been recognized for DNB and running more number of courses. The madam has put an effort, achieved this. So that has been recognized by the central government and the DNB board, and madam receiving this award, it encourages all our hospitals, Karnataka hospitals, to do in a much better way, increase so many other branches also. 23, there is a recent conference held KGM, Karnataka Government Association, with our presence of our CM and Health Minister. The state level prize has been awarded, that is Vaidya Seva Ratna. So this prize belongs to not only me, it is who have guided me in this and supported me from the district hospital staff, all over the staff, including from Group D to doctors, staff nurses. In 1958, it made as a MCH hospital, maternal and child hospital, medicine, surgery, orthopedics, ENT, ophthalmology, skin, radiology. First attempt on only we got obstetrics and pediatrics. So this is the one DNB, the major breakthrough for our hospital to improve. One is DNB course, and other thing what we got the 100-bed use, 100-bed MCH hospital, where we have had a shortage of beds to run the hospital. So during 2019, at that time, the government and our people representative and our DCs, when they asked, so they sanctioned this MCH hospital under NHM. Outpatient count was also very busy because it was almost outpatient. We used to 1,000 to 1,500 registrations. It was almost a bottleneck in the reception counter. That has been identified our people representative and as well as our deputy commissioner. So it has been allocated to have a one better OP counter and MRD, medical records department. So for that it has been allocated worth of 5 crores. Ballari has got a KMREC fund, Karnataka Mining Environment Restoration Committee fund, that has been allocated to our hospital nearly 286 crores. So now it has been almost approved with the upcoming another 2 to 3 years. The 200-bedded, further 200-bed hospital is going to be come up. So it will be almost 500 bed with a full price. So it has been sanctioned, and as well as we are going to start soon with a blood bank and a CT scan and MRI. CHD group of hospitals with our help of that time Nandini CEO madam. So the ventilators and BiPAP machines, these are all being donated. It was very useful for to run the COVID hospital, as well as from Nirman Institute, that is the Dodla Dairy. We received ICU cords and X-ray machines, ventilators also they have given. NMDC company, we received one school bus and two ambulances have been donated. The Jain people here, they have donated the food, the Arun Chirania. Throughout the COVID, for the patients, doctors, staff, everything they have provided for us that time to serve our people. At that time, the 2018, initially it was very tough to have DNB recognition. DNB team came and they visited for all these, the obstetrics, anesthesia, radio, all the departments. So they were very much satisfied regarding our obstetric services and as well as the pediatric services and the availability of the equipments, manpower, OT facilities. The award is only the recognition what we have done. It is the recognition to the hospital, to our people, even the Kaya Kalpa. We received the award in the Delhi with that time Honorable Health Minister JP Nadda. In 2021 we got the first place for this in this Kayakalpa. It was a very, very proud moment, national quality assurance standards, that we got 13 departments have been recognized. And after getting this also, it has helped to get into the Laksha facility, that is labor room and OT. We were into the platinum. Initially we had applied for the 4 departments. We got recognition for obstetrics and the pediatrics department. Later on, within one or 2 years, we got for anesthesia department also, DNB courses. And the other departments recently, last 2 years back, we got both as the diploma courses have been started. So ENT and as well as the family medicine. Initially in the 2000, getting the services in our hospital, even though it's a middle class hospital, even then the people feels very immense and amazing that what we are giving services, they are keeping confidence in us. That especially IAS officers or whoever the higher officers, we have to take a lot of care in that. Of course, whatever we are taking for a common man like that also, but we have to be more cautious in that. We used to get all the equipments from the DNB and infrastructure, especially library, and we got a DNB hall that is a worth of 1.25 crores to teach our students from the DMA fund. So these are all been, without a DNB, these things would have not come. But because of them, we are able to project our services and human services. Postgraduates are the pillars for that. Almost they help in each and to take care, quality care. It will be quality and quantity. Both will have increased unanimously and keeping more faith in our institutes. Academics has improved dramatically, regularly doing journal clubs and as well as the seminars.
We are running with all the 5 departments, that is OBG, pediatrics, anesthesia, family medicine and ENT. As you all know that we are running a tertiary hospital, and quality is of utmost care. To give a good quality care, we need as many human resources as we want. We can give round the clock services, so that is most important. Apart from that, apart from giving the quality services for the beneficiaries or the patients, we can even make them learn about the medical knowledge. During our COVID period, it was very horrible that postgraduates who are studying under us, they had helped us a lot, which was also very useful for us in combating with the COVID. Apart from our state patients, we get many patients from the neighboring states who believe that we are giving a quality services.
It is because of the great efforts by our Deputy Director then, Dr. Rimala Maroon Madam, and our beloved District Surgeon Dr. Ballari sir, we could get all the infrastructure and equipment as well as the teaching faculty to start the DNB courses. 2 years diploma courses in 5 specialties, that is OBG, pediatrics, anesthesia, and ENT and family medicine. We are planning to start DNB course in general medicine, and we are also starting a 2 years diploma course in ophthalmology. Because we had DNB students, it was very helpful because they helped us in emergency ward and ICU. And also in OBG, we have conducted more than 200 cesarean sections in COVID positive mothers. So it was very helpful having DNB students nowadays. Before our hospital became a DNB center, we had a acute shortage of doctors and manpower. So we were not able to manage high-risk surgeries and high-risk cases, and we used to refer to higher centers. So once our center became a DNB center, now because of manpower and because of postgraduates, we are able to manage high-risk surgeries and high-risk cases. Because of our district surgeons, the district surgeon Dr. Ballari sir's efforts, we could get all the necessary equipments and infrastructure as well as the teaching faculty, so that we can start DNB center. As per NBE guidelines, every student will have a peripheral postings. So for that, we have MOU with some of the premium institutions of our state, like Jaidava Institute of Cardiology, the Indira Gandhi Institute of Health, and Kidwai Institute of Oncology. And locally also we have MOU with Vijayanagar Institute of Medical Sciences, Ballari, so that the students get exposed to the super specialty cases.
Because of DNB, we have got extra number of qualified doctors who are willing and sincerely working for the patient's well-being. DNB is very much worthwhile. It is giving opportunity to more number of medical graduates, those who have completed MBBS, to achieve and become specialists in many fields. Useful, and it is a system which has helped entire nation to go a step ahead in the management of health of the common man, which will be at a very higher level when compared to simple district hospital without these postgraduate students who are dedicated and sincere in working. They have provided ventilators, multiparameters, HFNC machines, various other things which are very much needed in critical care of the pediatric patients and also the neonatal ward patients also. Honesty and sincerity in triad situations, in case of critical care ward, ICU wards, in regular maintenance wards of COVID wards also, they give tremendous service which was to be remembered or written in golden letters.
Caseload is very good. We get different types of cases. So the NICU is very good, the infrastructure is very good. We have a very good consultants. Procedures like we give surfactants, we do pleural tapping and all. So double exchange transfusions. So we do get very rare syndromes like that. Good library facility. So we have all the books. Good facility here. So we have good number of cases here. So rather than preferring MD in private colleges, so I suggest students to take DNB.
ICU with 25 bedded, even with ventilator support, CPAP. Even in wards we have ventilators, monitors, HFNC machines. We have a library in our department, and even we have digital library by providing clinical to every student. Diploma is the 2 years course done after the post MBBS. It's very good comparative to private medical college because as it is a government second, we get very good free hands with good patient loads.
General medicine, we provide emergency services like snake bites, poisoning, and then all MI and CVA cases, and also all routine cases, OPD cases also we treat, and all medium to moderate sick cases. With the help of students, we are able to take care of patients very well. We can provide very good health, good service to patients, and we can improve academically also. We are doing case discussions and all, and it is useful for patients also because we are able to give good care and quality care.
This hospital is well recognized for the patient flow. The amount of patients and the variety of patients every department is dealing with is very good. They conduct seminars on different topics, not only general medicine but all other departments like pediatrics, gynecology, ENT. We are also involved in those departments as well. So weekly we will conduct some seminars, clinical bedside evaluations, bedside case discussions, case presentations and all are very good over here. So for night rounds, night duty is also made easy due to the hospital accommodation itself. E-library or digital library facilities is also very good. All the books available at an ease. Family medicine is a good branch. You become a general physician. You can cover all the age groups. You can cover all sexes. It's not limited to a particular branch.
Ballari District Hospital is one of the best hospitals in the state. So District Hospital has provided a lot of facilities to modular OTs and plenty of multi-parameters. So many facilities are there provided. A beautiful DNB all constructed. Most of the services are provided by our dynamic district surgeon, Dr. Ballari, and is helping to our students, also to the Department of Anesthesia. If the DNB postgraduates are coming to here, they are strengthening the hands of the consultants.
District Hospital Ballari is one of the best district hospitals in all over Karnataka, and we have 200 inpatient services and COVID ICUs. We will be giving spinal anesthesia. GA cases will be there. Seen so many GA cases, and we have seen the critical cases. DNB is like it is almost equal to MD. We have a good practical knowledge.
So I am glad and I should be thankful to Mr. Basretti sir for providing me almost all equipments and facilities to run a department here. We do almost all cases as the level of the tertiary care hospitals, and to be one of the ranging wide from all ear surgeries like endoscopic ear surgery, microscopic ear surgery, and FES surgeries with advanced endoscopy, and we almost have all equipments related to the FES surgery like debrider. And in emergency situations also. DNB is one of the important board which is expanding in nowadays, which will help cater many populations, including the number of doctors will be increased, and simultaneously to take care health of the people.
This district hospital Ballari is one of the greatest institutes. We have a good operation theatre facilities here, and then we have a good audiometry room.
Our district surgeon, Dr. Bassareddy, because of his efforts, because of his hard work, because of his persuasion only, the DNB is being brought to this hospital. Surprisingly, when the DNB started here, the facilities and the infrastructure and the clinical work, the academic work increased enormously in multiple folds. And now, whatever gadget we want, whatever instrument we want, or whatever kind of a support we want, we get in a matter of few days only. Before the DNB started, the deliveries were around 100 and they were all managed by only the medical officers. And there was no postgraduate, there were no interns. Now we can see the charts here. Every year there is a leaps and bounds of increase. And at the moment we have got around 600 deliveries per month and around 300 cesarean sections per month. We have a very good clinical load. Because postgraduates are actually the pillar of any hospital, because they work round the clock and see that the quality of care given is increased. Around 50 to 60% are referred cases. They come from the peripheries, maybe covering around 50 to 60 kilometers, particularly from the Andhra border, from the Andhra districts, and also some of the Karnataka districts. So they are all referred cases, mean they are complicated cases. They are already handled outside, and our consultants are capable of managing any kind of obstetric complication. But if you go into the details, it is a more kind of a practical approach, more kind of a detailed approach, more kind of a structured approach is seen in DNB. In fact, the students become more skill enhanced. We had COVID ICU, we had HDU, and we were managing only COVID positive cases.
Surgical hands-on are very good, and number of different type of cases we get here. Got a good reviews, like to do a DNB from a good institute. We will be very confident when we finish our degree. Digital library is there. As regular teaching programs are there. Any new journals, any recent advances will be talked during the journal clubs. Every week will be new research methodology will be taught. And regular seminars will be there. Being a surgical branch, all OT surgical facilities are there. Surgical procedures, number of being a gynecologist, number of deliveries, different types of deliveries. E-library we have got registered for clinical key.
I'm from Maharashtra. Hands-on and all the kinds of cases, presentation and all the extracurricular activity, everything will be more here. So from there I have decided I'll take a diploma here in this district hospital Ballari. Compared to private medical college, the government DNB centers will be more cases for hands-on will get compared to the corporate or private hospital. The exam what we give is more tougher or more advanced level compared to the MD/MS.
We treat preterm babies and babies with any complications. We have all facilities in our NICU, including CPAP, ventilator, and we have expensive medicines also which are provided by our administration. People get treatment free of cost, and it is very helpful for the needy. We have a separate NICU which caters need for both inborn and outborn patients. Inborn, the babies which are delivered in the hospital, and outborn, like delivery takes place in surrounding PHCs and also in private nursing homes, from where babies are referred to us, and further we give treatment for them. DNB is helping us a lot because who have joined as doctors for training, and with them we are able to give a better care In SNCU, we have small minor procedures like we do LP, and we also have hearing assessment which goes on, and retinopathy of prematurity, and along with that major procedure in NICU is what we do call as exchange transfusion. So like we had divided our SNCU as one wing where only if babies were affected with COVID, we were treating such babies. Per month average around 500 to 600 deliveries take place.
ತರಬೇತಿ ಇದು ಒಂದು ನಾವು ಜಿಲ್ಲಾ ತರಬೇತಿ ಕೇಂದ್ರ ಬಳ್ಳಾರಿಯಲ್ಲಿ ಈ ಒಂದು ತರಬೇತಿ ವ್ಯವಸ್ಥೆಯಲ್ಲಿ ಮಾನ್ಯ ನಿರ್ದೇಶಕರ ಒಂದು ಮಾರ್ಗಸೂಚಿಗಳು ಮತ್ತು ನಿರ್ದೇಶನದ ಪ್ರಕಾರ ನಮಗೆ ನೀಡಿರ್ತಕ್ಕಂಥ ಒಂದು ವಾರ್ಷಿಕ ಗುರಿ ಅನುಸಾರವಾಗಿ ತರಬೇತಿಗಳನ್ನು ಹಮ್ಮಿಕೊಳ್ತೀವಿ. ನಾವು ಆಶಾ ಕಾರ್ಯಕರ್ತೆಯಿಂದ ಹಿಡಿದು ವೈದ್ಯಾಧಿಕಾರಿಗಳು ಹಾಗೂ ಕಾರ್ಯಕ್ರಮಾಧಿಕಾರಿಗಳವರೆಗೆ ಒಂದು ವಿಷಯವಾರು ತರಬೇತಿಗಳನ್ನು ವರ್ಷ ಪೂರ್ತಿ ಮಾಡ್ತೀವಿ. ವಿಶೇಷವಾಗಿ ಆಶಾ ಕಾರ್ಯಕರ್ತೆಯರ ಒಂದು ಇಂಡಕ್ಷನ್ ಟ್ರೈನಿಂಗಿನ ಆರಂಭಿಕ ತರಬೇತಿಯಿಂದ ಆಶಾ ಕಾರ್ಯಕರ್ತೆಯನ್ನು ಅವರೊಂದು ಆರಂಭಿಕ ತರಬೇತಿಯನ್ನುಗೊಳಿಸಿ ಒಂದು ವ್ಯವಸ್ಥೆಯಲ್ಲಿ ಬಿಡ್ತಕ್ಕಂಥ ಒಂದು ವ್ಯವಸ್ಥೆ ನಮ್ಮ ತರಬೇತಿಯಲ್ಲಿ ವರ್ಷದಲ್ಲಿ ನಮಗೆ ನಿಗದಿಪಡಿಸಿದ ಈ ವರ್ಷದ ಅಂದರೆ 2022-23ನೇ ಸಾಲಿನಲ್ಲಿ ನಮಗೆ ನಿಗದಿಪಡಿಸಿದ ಎಲ್ಲ ಒಂದು ತರಬೇತಿಗಳನ್ನು 95% ನಾವು ಪೂರೈಸಿದ್ದೀವಿ. ಉದಾಹರಣೆಗೆ ಹೇಳಬೇಕಂದ್ರೆ FRT ಇರ್ಬೋದು. ಈ ವರ್ಷ FRT ತರಬೇತಿಯನ್ನು ನಾವು ವಿಶೇಷವಾಗಿ ಪೊಲೀಸ್ ಇಲಾಖೆ, ಗೃಹ ರಕ್ಷಕ ಹಾಗೂ KSRTC ಇಲಾಖೆಯವರಿಗೆ ನೀಡಿದ್ದು ವಿಶೇಷ ಅನ್ನಿಸ್ತದೆ. ರಾಷ್ಟ್ರೀಯ ಆರೋಗ್ಯ ಅಭಿಯಾನದಲ್ಲಿ ಕೆಲಸ ನಿರ್ವಹಿಸ್ತಕ್ಕಂಥ ನಗರ ಆರೋಗ್ಯ ಕೇಂದ್ರದ ಸಿಬ್ಬಂದಿಯವರಿಗೆ ಈ ವರ್ಷ ನಾವು ರಿಓರಿಯೆಂಟೇಷನ್ ತರಬೇತಿಯನ್ನು ಮಾಡಿದ್ವಿ. ವಿಜಯನಗರ ಮತ್ತು ಬಳ್ಳಾರಿಗೆ ನಿಗದಿಪಡಿಸಿರ್ತಕ್ಕಂಥ 51 ತಂಡಗಳ ತರಬೇತಿಯಲ್ಲಿ HBYC ಹೋಮ್ ಬೇಸ್ಡ್ ಯಂಗ್ ಚೈಲ್ಡ್ ಈ ತರಬೇತಿಯನ್ನು ಪರಿಪೂರ್ಣವಾಗಿ ನಮ್ಮ ಜಿಲ್ಲೆಯಲ್ಲಿ ಮಾಡಿ 100ಕ್ಕೆ 100 ಸಾಧನೆಯನ್ನು ಮಾಡಿದ್ದೀವಿ.